Going to talk tonight about trauma interventions and the role that hypervigilance plays in our experience of trauma. So what is hypervigilance? We talk some about it, and we have other names for it, which we'll talk about in a few minutes. But I first thought it would be good to use a common definition, and where better to go than Wikipedia, because their description is really, really good. Hypervigilance is an enhanced state of sensory sensitivity, accompanied by an exaggerated intensity of behaviors whose purpose is to detect activity. So it's an enhanced state of sensory sensitivity. I think everyone would agree with that. That seems to be a really common description. It can bring about a state of increased anxiety, which can cause exhaustion. Many times we wonder, why are we so tired? I'm so fatigued. I'm just exhausted all the time. Well, some of that is because we live in a hypervigilant state. Other symptoms can include abnormally increased arousal, a high responsiveness to stimuli, and a constant scanning of the environment. So even when you hear that description, abnormally increased arousal, a high responsiveness to stimuli, which I would call more reactivity versus responsiveness, and a constant scanning of the environment. Think about the level of energy that it takes to live in a perpetually hypervigilant state. So some of the distortions that we use to describe hypervigilance, we'll go over in a minute, but I thought this little visual here is very cute. When I'm home alone, every noise I hear is a serial killer. And it shows a little minion there who's looking to the side, feeling a little nervous. I don't know, every noise I hear, I just, am prepared for the very worst. So what are some of the things, some of the distortions that we use to relate to our hypervigilance? We call it fear. We call it obsessiveness. We call it OCD, and that's usually sort of a blanket. We don't even use the full term obsessive. We say OCD, which means, I'm a little bit anal, or I tend to be somewhat compulsive, so don't question me. We have, we call it anxiety. We refer to it as just being cautious, careful. And then we also talk about it in terms of conscientiousness. That's when we're trying to give a positive spin to it. I know I may be OCD, but at least I'm conscientious. At least I have integrity. And so this is a way we try to normalize this heightened arousal state of hypervigilance. And what I want to discuss with you tonight fairly briefly, because I also really am committed to our sharing time, which is, sort of normalizing hypervigilance so that we can call it, well, fearfulness, obsessiveness, OCD, anxiety, caution or carefulness, being conscientious and integrous. Those are ways in which we basically tell ourselves, I don't think I'm ever going to get over this. I don't think there's any getting over it. So I'm just accepting this label, this distorted label that I'm putting on this, so that I can live with it somewhat comfortably, uncomfortably comfortable, if that makes any sense. We're not allowing ourselves to acknowledge that it's at the level that this minion is describing here, that every noise is a serial killer, but instead we're telling ourselves, well, I'm a little obsessive. I'm just cautious or careful, when really we're living in a heightened state of arousal that can lead to reactivity. And that's the reason I'm describing this, is because I really want everyone listening to this, everyone viewing this, to have a sense that that's a distortion and it's not something we have to live with. So when we are in the state, we're on high alert. And what does that mean? Why hypervigilance? Usually because, we may be suffering from PTSD. We may have an anxiety or mental health disorder. We are really trying to identify real external threats or danger. So that's why hypervigilance. The reason why we're on high alert is because we've had trauma in the past and we have PTSD, or we have a sense of foreboding or anxiety. It could be that we have a mental health disorder that may include some anxiety or even obsessiveness, like we talked about on the previous slide. But in this heightened high alert state, we're really trying to keep ourselves safe, right? That's the whole point for hypervigilance. If we're scanning our environment at all times, we're trying to be aware of perceived threats, eliminate those threats, or respond in a way that we keep ourselves safe. What it looks like is often triggers where we feel, nervous, racing heart, numbness. We're feeling a sense of foreboding or dread. We're anxious or cold. The fight, flight, or freeze can show up when we're in a hypervigilant state that gets sort of uber aroused. We can feel somewhat unpredictable, agitated, irritated, angry, a little bit like we've lost control, we're agitated. These are all good descriptors for what can happen when our hypervigilance is triggered in a really activated way. When we have low-grade hypervigilance all the time, we sort of normalize it like I was talking about earlier. But when it's more of a heightened aroused state, then we can experience it through our triggers. So here are some of the triggers that create the descriptors we just talked about. Being in overstimulating environments, which many people were over the holidays and are as physicians working in hospitals or other really demanding environments. Some triggers are fear of the unknown or unfamiliar environments or circumstances. Re-traumatization certainly gets the hypervigilance going. Crowds, loud noises, shaming, blaming, or embarrassment, intense or unrealistic demands, and those can be internal demands, not just external demands. It's not what our boss is expecting, what our patients expect. It's really what we demand of ourselves. Chaos, disorganized, chaotic environments. Fear of abandonment is a big one that can trigger hypervigilance, because if we have a sense that either as young children or in romantic relationships or in work environments, we have been abandoned, we've been left in the ICU with no support, and we're trying to problem solve as well as we can, but we're totally on our own, that can create a fear of abandonment. And then finally, pain. And that can be physical pain, it can be emotional, it can be spiritual and psychic pain as well, because the root source of this hypervigilance, which is often traumatic experiences, includes pain, fear, chaos, unrealistic demands, labeling and shaming. It can be overstimulating, loud, re-traumatizing, and bring up fears of the unfamiliar or unknown. Okay. And now, what is the action we can take? And this is the piece that really excites me, because I'd like to explore with you tonight some of the things that really, really, really are effective. And so what I'd like to talk about initially is engaging the peripheral nervous system. All of you probably are much more not probably, all of you are much more well-versed with anatomy and physiology than I am. Even with a college level anatomy and physiology class, I certainly haven't had the experience in the trenches where you're really talking about the central nervous system and the peripheral nervous system. But the peripheral nervous system is more of a voluntary nervous system that, from what I understand, are the nerves that are conducting the electrical impulses from the central nervous system. So within the peripheral nervous system are the sympathetic and parasympathetic nervous system. The sympathetic nervous system is the gas. The parasympathetic nervous system is the brakes. And so if we want to really help ourselves with this sense of hypervigilance that has become somaticized for us, then we want to engage the peripheral nervous system to work for us, since it's a voluntary system. So we want to integrate the important external information that we're conducting, that, scanning of the environment, picking up some external information like I'm noticing my hands are clammy, my breathing is rapid, and that I am feeling unsafe. And so we want to engage the sympathetic or the parasympathetic nervous system. If your response generally in these situations where you have low-grade hypervigilance and then there's an activating event that creates some fear, if you're someone who freezes, we want to engage the sympathetic nervous system. If you are someone who really becomes very, very agitated and wants to either fight or flee, then it's a wise choice to engage the parasympathetic nervous system, which normalizes and brings all of our systems back to a normal set point where we're more relaxed and feel in control. So one of the ways to engage the peripheral nervous system is through cold showers. And it's not just, turning on the cold water at the end of your shower to sort of, close off the pores. This is getting in the shower, maybe at a more tepid room temperature level of heat, and then turning it colder and colder and colder, activating the sympathetic nervous system. Because what happens initially is everything speeds up, right? Our heart rate, our respiration, maybe even our thought process, and we have the impulse to get out of the cold shower. But if you remain in the cold shower, breathing, saying, I'm choosing in this moment to be here, you will begin to activate that sympathetic nervous system, which is everything speeding up. But then there's an interesting thing that happens if you stay in the cold shower, which is a blunting, a way in which the sympathetic nervous system can only escalate so far, and then the parasympathetic nervous system kicks in, and we start to come down, 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 down. So a cold shower that you actually stay in for a few minutes can actually help engage that blunting parasympathetic nervous system, especially if you're highly activated. Breath work and meditation is a very good way to engage that voluntary peripheral nervous system in a way in which you're less hyper aroused and everything starts to calm down. And when everything calms down in the peripheral nervous system, then the central nervous system is positively affected as well. Acupuncture is really great way to activate the nerves and the nervous system that's peripheral. Biofeedback works really well. And now we want to talk about the central nervous system. To support the central nervous system, the involuntary brain, spine, cerebrospinal fluid, medications and supplements, especially those that are able to cross the blood-brain barrier, can be helpful, and that's why people take medications to help the central nervous system. And so it's sort of that external intervention, nutrition, what you eat, exercise, movement, cranial sacral work that really engages that central nervous system, the brain, the neurons, the way they fire, and then resting or sleep. Really, really good ways to support the central nervous system, that then if you have a calm and balanced central nervous system, your peripheral nervous system will be much less at risk of hyperactivation as well. So I just wanted to plant those seeds that rather than some of the, ask for help, communicate, move, some of those suggestions that we've had in the past, when it comes to hypervigilance, really working with your autonomic nervous system is critical, because that's the system that gets aroused in this situation, whether it's a chronic condition or whether it's more of a traumatic arousal and agitation that takes place. I'm not sure why each slide is pulsing, but I'll figure that out later. So proactive strategies, the strategies we just talked about, those were the interventions for the central and peripheral nervous systems, but that's sort of after the fact. If you want to have some proactive strategies to ensure that you don't get activated in the first place, here are some suggestions. First of all, scan for danger. You're having this response for a reason, and it doesn't matter if it's, a phone call or a conversation or something that comes in the mail or an actual conflict with someone or attack. Always scan for danger, rather than, when you live with a persistent state of hyper vigilance, we do normalize it, and it can start to feel like this is just the way I am. But on a day where you're feeling activated, you're feeling unsafe, you're noticing the chaos, you're feeling overstimulated, all the things that we have covered in earlier slides here, rather than trying to dismiss or immediately shift it, take a moment to scan to identify what is the danger. And, what exactly am I feeling threatened by? So once you've scanned for danger, then I want you to really validate your feelings. Don't stay in the place where you're either not looking that direction, you're avoiding, or you're minimizing or normalizing. Scan for danger, validate your feelings so that every part of yourself, including the traumatized parts, are reassured and supported by a system that is acknowledging the threat is real. Then once you've validated your feelings, I would like you to do something that may seem counterintuitive, and that is thank your fear. your fear is there for a reason. There's a book called The Gift of Fear. I have referenced it before. It is written by an ex-FBI agent who talks about the people who are victimized in the criminal world, who succumb, often disregard, minimize, or normalize their fear rather than acting or reacting. They shut down and sublimate their natural tendency to act and do something. So I think after you've scanned for danger, validated your feelings, pause and thank your fear for showing up to remind yourself that you could be at risk. You don't want to turn off the alarm system. You want to thank the alarm system. You know, when a fire alarm goes off, even if it's a false alarm, you want to be in gratitude for the fact that you have an alarm system, that it picked up the smoke from the toast you were making in the kitchen. And so you're safe in case of a fire. So you want to thank the fear. And then finally, take charge of your self-talk. If there's an inner critic who is having a heyday with the fact that you had an internal reaction, or is trying to talk you out of your sense of things. Oh, you always magnify everything. You're exaggerating. You know, you're just like Dad always said you were. You make a mountain out of a molehill. You know, take charge of that self-talk and ask the inner critic to leave, because this is a time where you validate your feelings, you thank your fear, and you take charge of how you want to process what just happened. And this needs to include a lot of positivity and support for yourself. You reframe your situation. If you have catastrophized, this is a time where self-soothing, taking charge of your self-talk, redirecting yourself is really, really important. That doesn't mean you have to minimize the danger, invalidate your feelings, you know, call yourself a wuss for the fact that you got wigged out in the first place. No, no, no. Reframe your situation in a way where it supports the validation, it supports the gratitude, and it supports a change in your self-talk. And then remove yourself and provide safety if that's what needs to happen. So that could mean, say you get unwelcome information through a phone call or a letter. That may mean that you need to take yourself out of your present environment where you sort of had the fight, flight, or freeze response. Remove yourself and provide safety for yourself. So for some people, they'll talk about, you know, taking a bath, or taking a walk, or making themselves a cup of tea. Some people, it means leaving the relationship, friendship, romantic relationship, work relationship, but it's okay to remove yourself. You've identified there's danger, you've validated your feelings, you've been in gratitude for the fact that your internal alarm system works, you're taking charge of your self-talk, you're reframing the situation so that you can feel positive, not activated, not re-traumatized, and then you remove yourself and provide safety. For some reason, I'm not moving to the next slide here. So this leads us to the post-traumatic stress slide, which we go over every time. Remember that if you're having flashbacks, intrusive or flooding feelings, if you're noticing the impulse to avoid, followed by hyperarousal and reactivity, cognitive issues such as depression, anxiety, PTSD, social anxiety, and then finally noticing difficulties with mood regulation. These are all signs of post-traumatic stress. And post-traumatic stress does not get better through shaming or blaming or minimizing or normalizing. Post-traumatic stress responds to interventions that are mindful, validating, proactive, that allow you to feel as if you have some control. And now it's time to share.